Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Please see additional important safety information at the end of this video.
Hello, I am Dr. Laxman Bahroo, Associate Professor and Director of the Residency Program for the Department of Neurology at Georgetown University in Washington, D.C. I will be speaking to you about clinical distinctions between tardive dyskinesia, or TD, and acute extrapyramidal symptoms, or EPS. TD is a delayed onset movement disorder that occurs in patients who have taken or are currently taking dopamine receptor blocking agents, or DRBAs, such as antipsychotics and metoclopramide, for at least a few months. The presentation of TD and acute EPS can sometimes be confusing. Acute EPS and TD are distinct entities and require specific management. An important factor in determining whether someone has TD and to differentiate it from acute EPS is the time symptoms present after starting a DRBA. Acute EPS usually occurs hours, days, or weeks after initiating a DRBA. Some examples of acute EPS are dystonic reactions, akathisia, and Parkinsonism, including tremors. This is an example of EPS. One can see an asymmetrical Parkinsonian tremor that predominantly occurs at rest. This is an example of jaw tremor. One can see the rhythmic movement of the jaw. This is not TD. This is an example of acute dystonia. One can see the right shoulder elevation with pulling and turning of the neck. On the other hand, TD, by definition, occurs with delayed onset to a DRBA. The DSM-5 defines TD as involuntary athetoid or choreiform movements that persist for at least a few weeks and do not resolve on their own. Although classically TD involves oral buccal lingual dyskinesia, it can also involve the trunk and/or the extremities. This is an example of classic TD, a delayed response to chronic exposure to DRBAs. One can see the dyskinesia of the oral buccal lingual region. This is an example of TD. One can see the impact of TD on the trunk and extremities. This is an example of athetoid or choreiform movements of the fingers, also called piano fingers. It is important to know that TD may also persist following withdrawal from a DRBA. When you assess your patients on antipsychotics, remember that timing of initiation of a DRBA is a key differentiator between acute EPS and TD. In addition, the athetoid and choreiform movements of TD make it a movement disorder clinically distinct from acute EPS.
Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Contraindications. INGREZZA and INGREZZA SPRINKLE are contraindicated in patients with a history of hypersensitivity to valbenazine or any components of INGREZZA or INGREZZA SPRINKLE. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, including cases of angioedema involving the larynx, glottis, lips, and eyelids, have been reported in patients after taking the first or subsequent doses of INGREZZA. Angioedema associated with laryngeal edema can be fatal. If any of these reactions occur, discontinue INGREZZA or INGREZZA SPRINKLE. Somnolence and sedation. INGREZZA and INGREZZA SPRINKLE can cause somnolence and sedation. Patients should not perform activities requiring mental alertness, such as operating a motor vehicle or operating hazardous machinery, until they know how they will be affected by INGREZZA or INGREZZA SPRINKLE. QT prolongation. INGREZZA and INGREZZA SPRINKLE may prolong the QT interval, although the degree of QT prolongation is not clinically significant at concentrations expected with recommended dosing. INGREZZA and INGREZZA SPRINKLE should be avoided in patients with congenital long QT syndrome or with arrhythmias associated with a prolonged QT interval. For patients at increased risk of a prolonged QT interval, assess the QT interval before increasing the dosage. Neuroleptic malignant syndrome. A potentially fatal symptom complex referred to as neuroleptic malignant syndrome, NMS, has been reported in association with drugs that reduce dopaminergic transmission, including INGREZZA. The management of NMS should include immediate discontinuation of INGREZZA or INGREZZA SPRINKLE, intensive symptomatic treatment and medical monitoring, and treatment of any concomitant serious medical problems. If treatment with INGREZZA or INGREZZA SPRINKLE is needed after recovery from NMS, patients should be monitored for signs of recurrence. Parkinsonism. INGREZZA and INGREZZA SPRINKLE may cause Parkinsonism. Parkinsonism has also been observed with other VMAT2 inhibitors. Reduce the dose or discontinue INGREZZA or INGREZZA SPRINKLE treatment in patients who develop clinically significant Parkinson-like signs or symptoms. Adverse reactions. The most common adverse reaction in patients with tardive dyskinesia, greater than or equal to 5% and twice the rate of placebo, is somnolence. The most common adverse reactions in patients with chorea associated with Huntington's disease, greater than or equal to 5% and twice the rate of placebo, are somnolence, lethargy, sedation, urticaria, rash, and insomnia. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. INGREZZA and INGREZZA SPRINKLE are available in 40 mg, 60 mg, and 80 mg capsules. Please see full prescribing information, including boxed warning, at INGREZZAHCP.com.